Hello friends, welcome to CNS Viewpoint. Today we are going to talk about a study which Dr. John Campbell had mentioned in his broadcasts that from Southern California, that people who were infected with Omicron and Delta, if you compare the data, then that study shows that people who had Omicron had far less hospitalization, had far less oxygen needs. Zero people were on ventilator, and the deaths were also, I think there was one death or so. But if you compare it with Delta, then of course the hospitalization was more. Hospitalization was longer. In Omicron, the hospitalization duration was 70% less. So oxygen needs in Delta, the people infected with Delta coronavirus was significantly higher. Ventilator need was acutely higher in people who were infected with Delta and hospitalized and serious, and death were also way more than what were reported with Omicron. Do look out for that study. So this is really important to understand, because this data reflects the similar trend, which is also so if you look at other data coming out from South Africa, from England, from France, from Spain, from other states of US, you will find that India also, you will find that people infected with Omicron are way less, significantly less. Number of people or proportion of people is less who need hospitalization, oxygen, ventilator or ICU needs compared to Delta. But as Dr. Tedros Adhanom Ghebreyesus, the Director General of World Health Organization, had said around in the second week of January 2022, that Omicron may be less severe, but please do not consider it as mild. Do not consider it as mild, because it is hospitalizing people. It is killing people. So, in where I am currently in India, probably, if we, as per the newspapers, yesterday we lost over 450 lives due to coronavirus disease. This is really very alarming. Every life matters, and if every life matters, we have to break the chain of transmission of coronavirus. And to break the chain of transmission of coronavirus, we can do few things. We can wear a mask properly, covering both nose and mouth. Try to keep a social distancing, physical distancing as much as possible. Please maintain sanitation and hygiene. If you feel sick, please self-isolate yourself in home. Governments need to make sure that social support services and all kinds of help and support should be there for every person, each and every person, so that they are able to make healthy choices. It is not only about individual. It is a failure of governance if people are not able to exercise the right to make healthy choices. So please make sure that is a very important role of the governments, and also to make sure that diagnostics, health services for COVID and non-COVID diseases, because there are a lot of non-COVID comorbidities that may put people at risk of COVID-19 and serious outcomes of COVID-19, and risk factors that fuel those diseases or comorbidities. For example, tobacco. For example, alcohol. For example, other risk factors which are already known and associated with those comorbidities. So let us hope that happens. And with this hope, I will end today's CNS Viewpoint, and we will be back again tomorrow at 5 p.m. India time with our thoughts and views and perspectives on something that made us think. Bye bye till then. See you.